Implant-supported denture is a denture, okay? The true difference is it's supported by implants. The downside to a denture is it rests on the tissue. It rests on the gums where the teeth used to be. If you have an implant-supported denture, you have that implant where it snaps in and is held in by those implants that are placed down under the gums. So it gets rid of some of the downsides to traditional dentures or conventional dentures that are held in purely by suction and retention on those gums. So patients are able to eat and chew better. They don't have to worry about using adhesives or glues to keep those dentures in place. With implant-supported dentures, anybody is a candidate that has proper bone in that area. Just like with other implants, implants that support dentures need bone to hold those implants in. So as long as you have the adequate bone there, you're a good candidate. And even if you do not have the adequate bone augmentation surgeries can be done to get that bone there. Implant-supported dentures can really be life-changing. One of my favorite things about implant-supported dentures are taking a patient that has had a poor denture or poor fitting denture because of lack of retention or lack of a suction on it, and being able to place a 2, 4, 6 implants in that area and having that denture held in place by the implants. Placing implants on the lower denture allows the patient to speak, eat, and not worry about that bottom denture moving.